UTI or urinary tract infection is the infection of your urinary system. So it can be infection of your urethra, your bladder, ureters or kidney. So the symptoms might appear as burning while passing urine. You can feel itching sensation near your urethra. You can experience urgency of urine. By that I mean that you might feel that you have an urge to pass urine again and again. The frequency of urination increases. The amount or quantity of urine decreases. The color of urine might change. It might become a little darker yellow, or if the infection is too severe, you might also experience blood in urine. You might also experience some pain in your lower abdomen. Sometimes patient may have symptoms of fever. And sometimes it is associated with a renal stone as well. How it is related to sexual intercourse. During sexual intercourse, there is exchange of bacteria from genital areas, near anal areas to your urethra. So urethra is an opening which lies just above the vagina. It is not covered with any membrane. It is open. It is smaller in women, which is why women are more prone for urinary tract infection than men. So during sexual intercourse, the urethra is exposed to disturbed bacteria which might travel from the urethral opening till the bladder, and they might just grow into the bladder and might lead to infections. So which is why it is found that a newlywed couple or people who have started recent sexual intercourse, they might experience recurrent urinary tract infection, which we usually call as honeymoon cystitis. What precautions you need to take to prevent yourself from urinary tract infection is that you need to keep yourself hydrated. Why? Because if you will keep yourself hydrated, you will pass good amount of urine that will help you to flush out the bacteria which are present inside the urinary bladder and your urethra. Second thing is, you need to pass urine immediately after sexual intercourse, so that whatever bacteria must have entered, they will just go away with the urine. Third thing is, do not hold on to your urine for too long of a time, because if you do not pass urine frequently, the bacteria which are growing inside your bladder are just lying down there and they will just breed more and more. Also, you need to make sure that you are using protective or a barrier method of contraception. What that will do is that will prevent the transfer of organisms from one partner to another. That will also prevent you from recurrent UTIs. Also, recurrent UTIs might be seen more frequently in women who have increased sugar levels. So make sure that you are checking on your sugars if you are having recurrent UTIs. Sometimes underlying immunocompromised conditions, some chronic disorders can also lead to recurrent UTIs. So make sure that you are talking to your doctor about it. So what if you are diagnosed with UTI? You need to make sure that you are speaking to your doctor, telling your doctor about your symptoms, what all symptoms you are expecting, what are symptoms you are experiencing, since how long are you experiencing, and have you taken any medications for the same. Also, your doctor will advise you some urinary tests just to confirm that there is infection. Also, to confirm which infection is there, what antibiotic is preferable for that infection. And I urge you to complete the course of antibiotics. What happens if you don't complete the course of antibiotics? There is a chance that your infection is not treated completely and you might not be full free of symptoms and you might have recurrent UTIs because of that. Also, if you are taking over-the-counter antibiotics again and again for recurrent UTIs, you might, expose yourself to an antibiotic-resistant bacteria, and for that you might need a higher antibiotic. So make sure you are not taking over-the-counter antibiotic. You're talking to your doctor whenever you have an UTI. Also, you're taking all the precautionary measures as I told you, and make sure that you are hydrating yourself enough. You are also maintaining your menstrual hygiene, because sometimes if the hygiene is not maintained during menstrual days, the sanitary pad which contains the blood might be one of the medium to grow, to outgrow the bacteria, and that might also lead to or make you more prone to UTIs. So also you need to follow all the preventions. And whenever you have all the symptoms, or if you see any symptoms, just make sure that you're talking to your doctor and you're completing your course of treatment. Thank you.